and after the surgery, you can have corneal opacity. Okay, I think we'll start the most beautiful woman you are seeing there, Aishwarya.
You also
Oh, thanks. So, ये जो है beautiful eyes and she has got a beautiful vision and she has pledged her eyes for donating the eyes. No? You also. But everybody क्या है, मतलब many times it happens that we fill up the form, we give to the eye bank, we have a pledge card, we put in our pocket, and our family members they don't know, they are not aware. ये सब नहीं किया ना तो भी चलेगा. आपने फॉर्म नहीं भरा, आपने आई बैंक में नहीं गए, कुछ नहीं किया तो भी I don't know why I want to put it. So especially in industrial workers and all, acid and alkali burns. Yes.
And sometimes, now that thing is not there, this car radiators, I seen a person trying to open it when it is hot.
With a speed. It's a force, with force.
Even that ammonia bottle,
That also, and even when they do that hammer and that, no, that also comes and hits the cornea.
then grinding and
Actually, welding जो है ना, welding का usually cornea is not affected. Welding में retina is affected.
grinding.
Color visions,
Yes.
Grinding. Grinding.
That can go into the cornea and lead to.
Puncture the eye.
Yes, of course. So trauma is very important. Then in children, vitamin A deficiency. Vitamin A, severe malnourished children, they have vitamin A deficiency, and because of that there is a corneal opacity. One more cause is nowadays even surgeries, nowadays all the surgeries we do, like cataract surgery or glaucoma surgery, those surgery also, if there are any complication of surgery, also can lead to corneal damage. And
hard cataract is there, it splits and
it hits the cornea. Because that's yes, of course, that's the reason nowadays people don't wait for the cataract to mature if it is hard cataract. Because क्या होता है कि last time I had told you regarding the cataract surgery, फेको surgery जो दिखाया था ना मैंने, पूरा break करके उसको cataract को निकालते हैं. तो that in hard cataract they have to break the nucleus which is hard, and those all hard particles can damage the cornea. So after the surgery also corneal damage chances are very high. So these are the three causes of corneal opacity.
what is the hard cataract?
Hard cataract में क्या होता है, the cataract which is there are two types. One is soft and one is hard. Hard means kadak, soft is naram. नहीं, different है. किसी किसी का hard cataract होता है, किसी का soft होता है. So different types it is. Both are different types. That you all will not know. Only doctor will come to know whether this is a hard cataract or soft cataract. Only by examination we come to know. So this is regarding your injury to the cornea. In fact, I've gone. Yes? Eye specs. Yes. Those were the days. Beautiful days.
All it will come back.
Yeah. So, especially this, Mahabharata and Ramayana ka wo Dhanushya Baran ka people used to sell all that, because of that many times children used to have injury, and because of that corneal opacity used to be there. Literally perforation ही हो जाता था. और ऐसे cases से हम लोग even corneal grafting करने के बाद patient never used to get vision because that injury was up to the end, not only in the cornea. With the speed it comes, no? So that was the thing.
Colors during the Holi, the chemical.
That also.
Diwali time.
Very important.
Diwali time.
Very, yes, very, very important. Diwali crackers, holy colors, yes.
Madam,
Holy colors.
especially holy colors. I remember that time I was in school life. I don't know, there is a branch. So they put me, and I don't know, and after in the afternoon, near about 1 o'clock, means get burning. My whole face are burning. So tonight I went to doctor. He recommended me to go to skin specialist.
Yeah.
But somebody recommended me that this curd and chane ka powder mix and put. So I put it and I put that
On the skin.
for the skin.
Yes. Yeah, because holy colors also they put anything, कुछ भी डालते हैं. Purposely they put included. Only Bombay up to Thana. So everybody, I want you all to remember 1919, which is very important, and I want you all to tell other people also, which is important. Now we are going to talk about the corneal blindness. The corneal blindness, what are the causes? Most common causes is injury. Because of trauma, there is a corneal injury, and because of that there is a opacity. Okay. Now most common cause of your injury is especially in children. Especially in children you will see the games like gilli dandu. The games we used to play. Abhi to koi khelta nahi hai. But we used to play that game. And because of Mahabharat and all that marble and Abadubi and abhi to all that games have gone. That I told you, Gilli Danda. Yes. All this. A beautiful day, Bombay.
Not even Thane.
Thane also included. Thane is included. So simple number up to Navi Mumbai.
Mumbai and Thane.
Yeah. So remember this. Huh?
Not Kalyan and all.
No. Up to Navi Mumbai means what I am saying. Navi Mumbai is not only Bombay. Only for Bombay. Not all over. Not all over. Not all over. It is in Bombay.
Only.
Within 4 to 6 hours. Very important. 4 to 6 hours.
1919 is number throughout the country.
Okay? Of course. They will take out the eyes. 1919. Just simple thing. 1919. You have to contact them. They will contact some eye bank which is nearest to your place, and the team of doctor and assistant will come to your house and tell you some universal number. But simple number I wanted to. Yeah, but any eye bank, of course. What will do? Kya karna hai? Very true. Now where you are going to contact? Where you are going to contact? Because at times suddenly don't remember everything. Kahan phone karna hai? People are aware.
Contact to my bank. You have to express your willingness to donate, and they will register your willingness. And as soon as that occurs, you have to be informed within 6 hours or something.
How you are going to go about it? Just wanted to know how much. And chances of rejection is very less.
With no blood, how it is managed?
So the nourishment of the cornea is by atmospheric air. The oxygen comes from here, and the liquid which is behind the cornea. The liquid which is behind the cornea, that is known as aqueous. That because of that there is a nourishment. Now I just wanted to ask you a few questions on eye donation. Can you tell me? I'll tell you properly. Can you tell me, suppose if you want to donate your eyes, in the cornea there is no blood. There is no blood. Doesn't have vessels. Because the cornea, why? Because by which you can match. There is no process chance. 30% of the patient can have rejection. Yes. You have to take the stitch.
But is there any process where you have to match?
There is no process. Less rejection. Not with this. With the instrument.
Acceptance, rejection problem.
Yes, it is there. It is there, but less. Not with the less. Let you know what are the causes. So here what we do, the corneal opacity which is in the center, we just measure it how much it is, and we make a cut around that diameter, either 6 millimeter, 7 millimeter, and take out this cornea, and the eye donation, whoever is done, that person's cornea, same diameter, we cut and then put it on this, which is transparent, and then take the sutures. With the instrument. White opacity ka causes adult effect also. The white, it may be, but
White spot is
that is known as opacity. Okay?
not a birth defect.
Yes, whatever corneal damage was there, it is healed. So what we see, either patient has got a blue eyes or green eyes or black eyes or brown eyes. But the anterior part is the cornea, which is transparent. You are seeing inside thing which is all of different color. So the cornea is very important. So suppose if there is a white spot here, so what we do? Usually central, because central is only important. If suppose the patient has got a white spot in the periphery, suppose इधर है, कोई problem नहीं, patient को तो दिखेगा, because your central part is important. What I told you, all the transparent structures and the central part is important. ये जो pupil है, there is a gap between this. ये जो central round thing you are seeing, that is known as a pupil. Okay? That's a hole in the curtain. This is a curtain which is opaque. Because of the light. Because of the light. When the light falls, it is constricted. When there is a less light, the pupil is dilated. That is a different thing. We are going to talk about cornea. So if the corneal opacity is in the periphery, patient's vision is good. Only in the central part, whenever there is opacity, patient's vision is reduced.
Opacity may not progress.
It depends. If the infection hoga, to it will progress. See, whenever we say opacity, opacity ka matlab hota hai, it is healed. This iris seeing is, see, whatever we are seeing actually whatever black we are seeing that is cornea, but it is transparent. Whatever we are seeing is inside iris. That is the reason all different people have different color of the eyes. So whatever we are, this. We remove and put on the patient's cornea. You understood? The donor's cornea only if there is an eye donation, and by donation what we know of your occipital cortex, all these other things should be normal. Only if there is a corneal opaque, if the cornea is opaque, then very important, your retina should be normal. Your retina, your optic nerve. Here blindness, and because of that patient is not seeing. White spot on the cornea, that is a corneal blindness. That is a corneal birds. They have a. Suppose out of all these causes, if the cornea, which is transparent, if there is any damage, if it becomes opaque, you must have seen many patients, especially beggar donation. If this is affected, patient will not see. Okay? One of the cause. Here I am saying this, why? Because we are going to talk about the blindness which can be cured by eye donation. Then it will go to the brain. Suppose in the brain if there is any damage and everything is normal, optic nerve is also normal, everything is normal. But the last center, this rays of light will focus on the retina. Through the retina it will go to the optic nerve, and yes, very important. Because all depends upon how much is the damage to the optic nerve. If it is a total damage, patient will not see.
If there is a damage to the optic cortex,
then also. One of the anterior cause is if there is any, it becomes opaque, if the transparency is lost, then also patient will not see. Suppose in the anterior chamber, if it is hazy, because of some infection, then also patient will not see. In the pupillary area, if there is any problem because of the infection, again patient will not see. This is the last time I had told you, this is a cataract where normally it's transparent, and here suppose it becomes opaque, then also patient will not see. Suppose this is a liquid, if there is any hemorrhage or it becomes opaque because of infection, then also patient will not see. In the retina, this is everything is normal, but if there is a problem in the retina, patient will not see. If everything is normal, optic nerve, which is very important, if there is any problem in the optic nerve, patient will not see. This I am just telling you because the causes are many.